At first it was really easy getting me diagnosed and things like that. But once I had to start talking to a counsellor, that's where it all got really messy.
So unless you ring the doctor's surgery, you probably don't have any connection with them. I can't think that they communicate at all to me personally.
Partly because we're all getting older and living longer and having more illnesses to deal with.
It's a kind of a range of changes happening all the time, driven by new devices, new software, new applications. Fundamentally, it's incredibly difficult for organisations to cope with complexity.
Like, I've had to really Google around for information. Like, I'm waiting for some results at the moment, and I haven't been told how I'm going to be receiving them.
I think there is a fundamental disconnect in society between the system and the people.
It's always difficult to step back from the day-to-day delivery and imagine how things can be done differently.
All talking about the language of integration, and the big things in the room that were getting in the way of that were absolutely massive.
We all have competing priorities and competing problems, but actually if we're going to change things, we have to believe that we're all in there for the same reason, and we have to share the power.
We help organisations and leaders connect with their stakeholders, their communities, whether they're local, national or international. We help them simply see things differently and do them better. Three-dimensional engagement underpins everything we do. First, we create real understanding and connection between the social, the cultural, the data, the community, the people, the place. Phase 2, we move into co-creation, and we bring people together to create their plans and their big ideas for the future. Phase 3 is when we help people communicate, not any old way, in authentic ways, in ways that really inspire and engage people and therefore create change.
It's about looking at things from a fresh perspective. It's about joining up the dots. It's about a big picture, but with the knowledge and insight of all the local and national issues.
So you need people who understand technology and software, but that's not enough. You can't just be interested in technology and software. You need to put those people together with people who understand patients.
We have a fantastic sounding board, so we always have fresh perspective on every project. We bring together a mixture of disruptors as well as the perfect brains with the experience of the issues that you're dealing with.
There can be arts, there can be music, there can be digital technology, not necessarily health.
We use film in really imaginative ways. It sees things as they are, and we use it to show you things, we use it to research, we use it to tell stories.
It's an approach which is about understanding the people that they're engaging with, understanding the context in which they're operating and designing their approaches accordingly.
We've used the power of the crowd and crowdsourcing to collect the wisdom of stakeholders in over 40 countries.
One of the things Social Kinetic did for us is they went and understood our community and helped us understand maybe where our gaps were and where our problems were.
NHS Change Day was one of our highlights, helping to create one of the world's largest social movements in healthcare, which is being replicated around the world.
I think it's really good to have people come along from the outside and view what you're trying to do and challenge you.
You might be an organisation wondering, are we in the right place? Are we doing the right things with the right people? Or you might want to change behaviours. You might want to empower people to live a better, healthier life.
We are all integral to the health service in our communities. It is a life cycle.
I don't actually have a problem giving power away and allowing the public to have power and to make decisions and to be part of that, and allow other organisations to lead on your behalf. I find it quite empowering to actually be able to say to people, over to you. I don't know.